Welcome back from the break. We hope you're able to get something refreshing to drink. Moving into our first presentation in this session, FDA will discuss the benefits of GDUFA 3 DMF prior assessments and explain key elements of the associated guidance. Our presenter, Dr. Erin Skoda, is currently a branch chief in the Division of Lifecycle API in the Office of New Drug Products within OPQ and CDER. She has worked on CMC quality assessment, division initiatives and policies, and collaborates with numerous divisions and offices within the agency. For our second presentation, we welcome back Dr. Jayani Perera to discuss the overall process for the GDUFA 3 DMF prior assessment enhancement, including a tutorial on how industry can submit a valid request following the guidelines provided in the appendix to the draft guidance. Our third presentation will describe the different types of prioritization factor categories and how we determine if a DMF would qualify for a prioritization under those categories. Our presenter, Commander Ian Morgan, is a pharmacist for the Division of Legal and Regulatory Support. He began his career in FDA in 2004 with the Regulatory Support Branch, now the Division of Filing Review. He transferred to the Office of Generic Policy in 2013 and assisted in developing the Patent and Exclusivity team within DLRS. For our final presentation in this session, we welcome again Dr. Perera to present some questions and answers and best practices for the GDUFA 3 prior assessment process, focused on fostering a better understanding so that industry can take advantage of this enhancement. Please join me in welcoming our first presenter, Dr. Skoda.
Thank you for that introduction. As you heard earlier, the Generic Drug User Fee Amendments of 2022 includes enhancements to drug master file assessments. Over the next few presentations, we will focus on the DMF prior assessment enhancement. I'll get started now with an introduction and overview to this new assessment process, and my colleagues Jayani Perera and Ian Morgan will present more of the details in subsequent presentations. The learning objectives for this presentation are to understand what a prior assessment is, know what conditions apply to a prior assessment, describe the benefits of the prior assessment process, and explain the key elements of the associated guidance. We'll start at the beginning to clarify what a prior assessment is. Prior assessments are the review of Type 2 drug master files for API DMFs before the submission of certain abbreviated new drug applications and prior approval supplements. The descriptions of the ANDA and PAS submission criteria are described in sections 3A and 3B of the associated guidance, and the guidance is linked throughout my presentation. If the applicant meets the criteria, the DMF will be reviewed during the 6 months prior to the ANDA submission. To initiate this process, the prior assessment review must be requested by the DMF holder. And the DMF must meet certain conditions which are described in later slides. In order to understand this new prior assessment enhancement, it's helpful to be familiar with the standard review process, which we've been using under GDUFA 2. A standard 10-month ANDA review clock is visually represented here. All review timelines are centered around the ANDA, with the start being the ANDA receipt. All DMF scientific review work takes place during this 10-month ANDA clock. However, the DMF is submitted well before the application is received, and during this time, we finish the completeness assessment, or CA. No scientific review work takes place during this time before the ANDA receipt that's shown in green. The DMF scientific review starts at approximately month 2 of the 10-month ANDA clock. If the first cycle review results in a complete response, or CR, and the response is received within the recommended 30 days, a second cycle review is also completed. In reality, however, the average response time for a first cycle DMF CR letter is longer than 3 months. So we often don't have time for a second review cycle before the GDUFA goal date. I want to mention also that there are a lot of milestones that are listed on this timeline, and I'm just focusing on the ones that are affected by the prior assessment specifically. But if you have questions about the other aspects of the scientific review clock, please see my presentation from the 2021 DMF workshop that's linked here on the slide. Now, compared to the standard review timeline that is shown on this slide, the new prior assessment timeline allows for a longer review clock by making some significant changes. Instead of the DMF scientific review starting after the ANDA filing decision is made, the DMF prior assessment enhancement allows for the start of scientific review before the ANDA is even received. For DMFs that are referenced by certain ANDAs, the DMF would undergo triage to determine whether it meets the criteria that are described in the guidance. And then the scientific review would start in the 3 months during the 3 months before the ANDA receipt. This would allow us to then send any relevant IR comments by the time the ANDA is received. This will give the DMF holders more time to address and respond to any deficiencies. Once the IR response is received, scientific review can commence and any additional deficiencies will be sent in an IR or a CR. The goal of this GDUFA 3 enhancement is to get the DMF to an adequate status as quickly as possible. During the scientific review cycle, we'll be looking to resolve issues via IR as often as possible until we run up against the end of the GDUFA clock. As you can see in this timeline, this longer DMF review clock allows for a real chance for multiple DMF review cycles before the end of the application clock, even when it takes longer than 30 days for the holder to respond. So it's clear from this timeline that this enhancement has real benefits for the DMF review process. Some of these benefits include a much longer scientific review clock for the DMF. As I pointed out, the several months prior to the receipt of the ANDA will be used for the first cycle of scientific review, allowing for significantly more time for responses and review of those responses. This enhancement will also improve the efficiency of the application assessment cycle, and we expect to see more first cycle approvals. Ultimately, we all want to see more timely access to generic drugs for patients, and we believe that this will aid in that goal. Now that you understand what a prior assessment is and what the benefits are, you're likely wondering which DMFs and applications are eligible and where you can get more information about this enhancement. In October 2022, the FDA published the draft guidance for industry entitled The Review of Drug Master Files in Advance of Certain ANDA Submissions under GDUFA. You can use this draft guidance for all information related to this enhancement. The guidance explains how the enhancement works, and it also describes what the DMF holder should do, with specifics included in the appendix on how to request the prior assessment. And this guidance can be accessed via the link shown on this screen. So, which Type 2 DMFs are eligible for the prior assessment? Only DMFs for which FDA has not conducted a substantive assessment can be considered for the prior assessment review process. So, what does that mean? Essentially, if the DMF previously had a full technical review to support an application, the DMF would not be eligible. Now, if the DMF was previously only referenced and reviewed for an IND instead of an application, for example, that would not count as a full assessment. In the context of the guidance, the DMF would be considered as not yet assessed, and then it can be reviewed under the prior assessment timeline. DMFs are not automatically considered for prior assessment. The prior assessment must be requested by the DMF holder, and this request should be received 6 months prior to the expected ANDA submission date. And it should be noted here that the guidance does allow for waivers of the 6-month requirement when there is a matter of public health or drug shortage and the holder is unable to submit the request in time. For more information on that waiver, you can see the appendix of the guidance, specifically footnotes 21 and 22. Some conditions apply to the DMF eligibility, which are related to the referencing application, and we'll discuss these on the next slide. In order for a DMF to be considered for a prior assessment, it will be referenced by an abbreviated new drug application. And these include an original application, an amendment, for example, a response to a CR or an unsolicited amendment to add a new supplier, an ANDA amendment seeking approval for an ANDA that was previously tentatively approved, or a PAS to add a new API source. And I'll also refer you to the GDUFA 3 commitment letter. In addition to the referencing application being one of the types listed on this slide, the ANDA must also meet some additional conditions. The application that will be referencing the DMF must meet one of the requirements listed in Section 3A of the guidance. You can also see Ian Morgan's presentation later this morning for the specifics. These conditions were chosen to help meet the goals of the enhancement, and things like number of approved products, patents and exclusivity, or drug shortages are considered. While I won't be covering the specifics of that here, the thing that I want to stress is that communication between the DMF holder and the applicant is essential in this process, since the ANDA must meet one of the requirements, and the holder must include this information in the cover letter of the request. When the DMF holder submits the request for prior assessment, there are some key items that also need to be included. The request for a prior assessment should be submitted to the drug master file, and it should include a detailed cover letter. Items that should be included in this cover letter and in the holder's request are shown on this, or will be shown on this slide, and are discussed in more detail in the appendix to the related guidance, as well as in Jayani Perera's upcoming presentation. In brief, the cover letter should include a letter of authorization giving an applicant the right to reference the DMF, an RLD or reference listed drug listing from the Orange Book, documentation of the drug master file holder fee that had been paid previously, and a justification from the conditions for the ANDA that was referenced on the previous slide. And these will also be discussed again during Ian's presentation. So now that you're aware of the key elements of the guidance, you may be wondering about the specifics of the new timeline for the prior assessments. This is an expansion of the timeline I showed earlier, and it focuses on the 6 months prior to the ANDA submission. Here you can see that the ANDA receipt is shown at the end of the timeline, but this date is also the start of the 10-month standard ANDA review clock. The request for prior assessment for the drug master file should be received from the DMF holder 6 months prior to the anticipated referencing ANDA receipt date. These two dates mark the start and end points of our zoomed-in timeline. Shortly after the Division of Lifecycle API receives notification of the prior assessment request, we will work with the Office of Generic Drugs to triage the request over about 10 to 14 days and strive to grant or deny the request by about 2 weeks after that. I encourage you to refer to the guidance and its appendix as you prepare your request to minimize any potential delays in this timeline. If the prior assessment is granted, the DMF target date, or DTD, will be provided in the letter. This date usually corresponds to the date of the application submission, and the scientific review for the drug master file will take place normally in the 3 months prior to the DTD. The DTD is also the approximate date by which we will issue an IR if necessary. In this case, the first IR is equivalent to the first CR or complete response that you would have received under GDUFA 2, which means it will include all quality deficiencies and any deficiencies that would result from pharm tox consults. If the prior assessment is denied, this does not preclude a holder from submitting another request for a different application or after there is a change in circumstances that might make the request approvable. So in other words, a denial does not determine our decision for future requests. In this new process, we believe that communication will help things move more smoothly. And I want to take a moment to summarize the various communication pathways on a single slide. The request for prior assessment is submitted from the DMF holder to the agency in a DMF submission. When this happens, the DMF holder should also send an email to the DMF OGD mailbox, that the email address for which is shown on this slide. This email is the trigger for our prior assessment triage process, and it will allow us to work with you to correct any errors that we find when we evaluate the request. And although both the DMF itself and the request are submitted by the holder, the applicant must be consulted to get some of the relevant information and knowledge related to the prior assessment request. These things include determining whether an ANDA meets the conditions for prior assessment, verifying that the pre-assigned ANDA exists, determining the expected submission date for the ANDA, and drafting an accurate letter of authorization. And finally, the agency will issue a letter to the DMF holder granting or denying the request, and the letter will contain a date by which we're committing to finish the review if the prior assessment is granted. A few things to consider before submitting your request are shown on this slide. Please remember to make sure that the DMF is complete by referring to the Completeness Assessment or CA guidance. You should always strive to respond to IR letters in a timely manner to keep the review timeline moving. The DMF holder should communicate with the referencing applicant and refer to the guidance conditions related to the application. And please include all relevant information in your request, and remember to let the Division of Lifecycle API know that you're requesting the prior assessment by also emailing the DMF OGD mailbox when you're requesting the prior assessment. This slide contains additional resources that I've linked throughout my presentation. So again, your main source of information is the draft guidance for industry that was recently published, and this covers all aspects of the prior assessment process. There's also the GDUFA 3 commitment letter that has additional details on GDUFA 3 changes and enhancements. The completeness assessment guidance will be very useful in making sure that your DMF submission is complete so that your scientific review goes much more smoothly. The Orange Book will be necessary for consultation when you're preparing your cover letter for the prior assessment request. And then finally, for all things related to drug master files, this DMF at FDA page that I've linked at the bottom has useful templates and other information, including news on updates that we've made. So I encourage you to regularly check back at this website. So to summarize the presentation, GDUFA 3 allows for prior assessments of some drug master files. Communication with the FDA and the ANDA applicant from the holder is essential for success in a prior assessment process. And please refer to the draft guidance for all details so that your submission is successful and that you're aware of all of the requirements and the details related to the prior assessment process. I'd like to thank the individuals listed on this slide for input into my presentation. So thank you to Dave, Jayani, and Jennifer. I'd also like to thank the CDER SBIA for organizing this workshop and also for the opportunity to speak today. And finally, I'd like to thank all of you for your attention and interest in this presentation. This concludes my presentation, and I'll be back shortly to answer any questions during the Q&A session.
Thank you, Erin, for presenting the benefits of GDUFA 3 prior assessment process and explaining the key elements in the draft guidance. In this presentation, I will go over the prior assessment request triage process done by the Division of Lifecycle API, and I will also do a tutorial on how to prepare the cover letter. In my first presentation, I gave you an overall overview of the prior assessment implementation process, so you are already familiar with this process. In this presentation, we will go over the process again, highlighting some important points, and then in the subsequent slides, we will take a look at what type of information should be included in your prior assessment request. When the prior assessment request is submitted to the DMF as an amendment and processed by the document room, the first stage of triaging is done by the Division of Lifecycle API, DLAPI. This is to check whether the relevant information is included in the cover letter. It typically takes DLAPI about a week to triage the request. So as I mentioned in my previous presentation, if basic information is missing in your request, we give you a chance to fix it by issuing an IR. So this is a 5-day IR. Some examples of issues that we would issue a 5-day IR are like user fee has not been paid, letter of authorization is not present, or you didn't include the pre-assigned number. So these are things very easy to fix, but when this information is not there, then we cannot move forward with the full evaluation of your request. So we give you a chance to provide that information to us. If we do not receive a response to this IR within 5 days, your request will be denied. If you submit the response within 5 days, but you fail to include the required information, that means the required information is still missing from your submission, then your request will be denied. A reason to deny a request directly is if you don't submit your request 6 months in advance and you don't qualify for a waiver. So as mentioned before, we will not be able to send you an IR if you don't have a secure email address. We cannot mail or fax these short turnaround IRs. So it is very important that you obtain a secure email address. So after DLAPI completes the triaging, and if all the relevant information is now included in the cover letter, the next stage of the triage process is done by the Division of Legal and Regulatory Support, DLRS. So DLRS will take a look at the justification statement listed in the cover letter. This is to see whether the DMF would qualify for a prior assessment. So after the triaging is done by both DLAPI and the DLRS, which would typically take about 2 weeks and maybe a bit longer if we issue an IR, a fix-it IR. So after that, we either grant or deny the request. If granted, we issue the grant letter and we conduct the review to meet the date indicated in the grant letter. If denied, we issue a deny letter. So as stated in the draft guidance, when you submit the DMF prior assessment request, please send a notification email to the DMF OGD mailbox. This is to ensure timely processing. Let's talk about how to submit a proper prior assessment request. So the cover letter should contain all the key information as outlined in the guidance. Submitting the form 3938 is optional. If the DMF already has the relevant letters of authorization, then you don't need to resubmit them. But if the required LOAs have not been submitted, then they should be submitted with the prior assessment request. We recommend documentation of fee payment when you pay the fee, but it is not required. If you would like to submit the fee payment documentation, which is the Form 3794, with your prior assessment request, that is fine. If you decide to use Form 3938, this is how we recommend you use it. You should select Other in Field 7 and then enter GDUFA DMF Prior Assessment Request. Also in the same field, select LOA if one or more LOAs are included with your prior assessment submission. So how do we prepare a proper cover letter? The details on how to prepare a cover letter are in the appendix to the guidance, which is the review of master files in advance of certain ANDA submissions under GDUFA. I added a link to the guidance here. So the cover letter is actually the most important part of the prior assessment request submission. This is where you will put all the information that is mentioned in the appendix to the guidance, which will allow us to do the triaging. If you fail to include the requested information mentioned in the guidance, then the processing of the prior assessment request will be delayed. The delay is because we give you a chance to fix the request with a 5-day IR. This I mentioned before. If you don't send the response within 5 days, then we deny the request. In the subsequent slides, I will go over each element in the appendix along with some example language you can use when you prepare your cover letter. A lot of the information that is being asked in the cover letter has to come from the applicant. You will need detailed information about the drug product and what is in the application. DMF holders are typically not familiar with this type of information. For example, pre-assigned ANDA number, the planned submission date of the application, the RLD information like the drug product and the strengths, and also input on selecting appropriate conditions listed in the guidance that apply to that application. For example, patent and exclusivity. So these are not information the DMF holders are typically familiar with. So that is why the communication between the DMF holder and the applicant is critical when it comes to submitting a successful prior assessment request. So let's go over each of the elements in the appendix and also take a look at some examples. It is very important that you indicate in the cover letter that the amendment is a GDUFA DMF prior assessment request so that the document room processes it properly. You need to indicate or you need to include a clear statement granting FDA permission to perform a scientific review of the DMF. You also need to include a clear statement indicating the type of ANDA submission, whether it is for an original ANDA, ANDA amendment, or a prior approval supplement. Here we provide you with an example text that you could use when preparing your cover letter. This corresponds to what is in the appendix of the draft guidance. This is just a basic statement that is similar to what is in an LOA. So in this statement, you, the DMF holder, is granting FDA the right to perform substantive review of the DMF. Here you add the DMF number and the subject, and then you tell us who is submitting the application. That is going to come at some point in the future. And then you also add the type of submission. That is whether it's an original ANDA, ANDA amendment, or a prior approval supplement. As mentioned in the guidance, fee payment is a requirement for submitting a prior assessment request. So we ask that you put in a certification statement that the DMF is active and the user fee has been paid. If there is any issue with your payment, we may refer you to the Office of Management to resolve the issue before processing your request. Fee issues are the things that we mention in the Fix-It IR. So here is a sample statement you can use as your certification statement stating that your DMF is active and the user fee has been paid. It is not a requirement that you pass the completeness assessment. But if you have already paid the fee and undergone the completeness assessment and the DMF is already available for reference, you can just include a statement that the DMF is already on the available for reference list. For example, you can say, we certify to the best of our knowledge that the DMF is available for reference. It is required that the fee is paid, but it is not a requirement that the DMF is available for reference. So if there is a completeness assessment that is pending at the time of your prior assessment submission, once the prior assessment is granted, it will be completed as an administrative completeness assessment, and the DMF will automatically go to the available for reference list. Regarding the letters of authorization, we include a couple of optional language you can use. One is where the letters of authorization applicable to the request is already submitted to the DMF. So you can add the statement that the DMF includes a valid letter of authorization, and then you add the authorized party. The other one is where you are including the LOA with the amendment of the prior assessment request. So in this case, you say this amendment includes a valid letter of authorization, and you add the authorized party. Now we will discuss the application related information that should be included in the cover letter. The DMF holders need to get this information from the applicant before they can submit a prior assessment request. So to submit a valid prior assessment request, you need to have good planning and communication with the applicant. First, we will go over the prior assessment request to support an original ANDA. The prior assessment request submission should include a citation to the reference listed drug, RLD, with the NDA number and the drug product or products, including all strengths that will be included in the ANDA submission. So why do we need the citation to RLD? The reason is when we review a DMF with reference to an original ANDA, we review it in the context of the specific drug product. So we need to know the drug product and the conditions of labeled use. Without the labeling information, we don't know the things like the maximum daily dose or the patient population, so we cannot proceed with our review. Since the ANDA has not been submitted yet, the only way for you to let us know what drug product the ANDA will be for is to give us the RLD reference from the Orange Book. So in the next slide, I will show you an example of an Orange Book reference. You also need to include a pre-assigned ANDA number and the authorized party. Here is sample language you can use in the cover letter to indicate the pre-assigned number and the authorized party. Here is an example from the Orange Book. This is for pantoprazole sodium. The reference listed drug information that we are going to need is the NDA number, the name of the product, and also list of strengths that will be included in the ANDA application. When you include the strengths, it may not be necessarily everything that is listed in the RLD labeling. It should be limited to those strengths that are going to be in the ANDA submission. If your prior assessment request is going to support a prior approval supplement to an approved application or an amendment to a pending application, you need to include the existing ANDA number and the authorized party. So for example, you can say this request is to support, you include the ANDA number and the authorized party. So continuing with the application related information needs to be submitted in the cover letter. Let's talk about when the prior assessment should be submitted. The submission date for the ANDA should be at least 6 months from the prior assessment request submit date. Here is example language you can use in your cover letter where you state the plan submission date is, and then you add the plan submission date of the ANDA application. The application plan submission date you indicate in the cover letter will serve as the target completion date for the DMF assessment. The target completion date is the date we plan to finish the DMF review and prepare your IR. You will likely receive the IR on or within a few days of the target completion date. After we grant the prior assessment request, if you think the application cannot be submitted on the date communicated in the cover letter, please let FDA know as soon as you can by sending an email to the DMF OGD mailbox. For drug shortage or products that could help address a public health emergency, a request to waive the 6-month condition may be included in the cover letter. This is when the DMF holder is unable to submit the request 6 months in advance of the plan and the submission. Here is example language for you to use if a waiver is desired, where you add the plan submission date of the application and state that you are requesting FDA waive the 6-month condition, and you clearly indicate the qualifying factor. If we grant the waiver, we will make every effort to complete the assessment on or before the plan submission date. But if we get less than 3 months advance notice, it is not practical for us to triage, assign, and conduct a review. So a later review target date may be assigned. However, the DMF assessment will still be finished significantly earlier than when no prior assessment was performed. So the justification statement is basically including a statement in your cover letter to indicate why your DMF should qualify for a prior assessment. For original ANDA, an ANDA amendment containing a response to a CR, or an amendment seeking approval of an ANDA that is previously received a tentative approval. So in these cases, you go to Part 3A, items 1 to 5 of the draft guidance to get a statement for each of the applicable justification. I will show you an example language you can use in the cover letter in the next slide. So for a prior approval supplement, you need to include the applicable justification from Part 3B, items 1 to 2 in the draft guidance. So this is where the input from the applicant is crucial so that you select a prioritization criteria that is appropriate for the application. Everything you need to know about the prioritization factors will be covered in the next presentation by my colleague Ian Margand. So to give you an example for an original ANDA, you can say the following justification or justifications apply to the plan application submission, and then you can copy paste the applicable language from the guidance. We have provided one example language here, but you can add more than one if more than one criteria applies to the application. So this is the information you need to get from the applicant. So the communication between the DMF holder and the applicant is key to submitting a valid request. Signature and notification. This is very important. So who's going to sign the cover letter? So it has to be the responsible official at the DMF holder, not the DMF agent. Last but not least, when you submit the prior assessment request, please send a notification to DMF OGD mailbox so that we can process your request in a timely manner. So here we provide you with an example cover letter as a resource. This contains all the basic information such as DMF number, holder name, type of DMF, and subject. Make sure you clearly indicate the submission type. Some of the elements we just covered: granting FDA the right to review, DMF available for reference, and the pre-assigned ANDA number and the name of the authorized party. RLD information, plan submission date, justification statement, and finally, signature of the DMF holder. So you can take a look at this and use it as a guide when you submit your prior assessment request. In conclusion, we went over the contents of a proper prior assessment request, including application-related information, which should be included in the cover letter. We also shared with you some sample language you can use when you prepare the cover letter. Again, we emphasize, when submitting a prior assessment request, the communication between the DMF holder and the applicant is paramount. If you have any questions, you can reach us at DMF OGD mailbox. This slide contains some helpful links. And that brings us to the end of my presentation. Thank you for your time and attention. I will come back later to answer any questions you may have during the Q&A session.
Good morning, good afternoon, or good evening, depending on your current location. Thank you for attending today's DMF workshop. I am Commander Ian Margand. I am currently working in the Division of Legal and Regulatory Support and in the Patent and Exclusivity Team subgroup. We are also known affectionately as the PET. The role of the PET in the DMF review enhancement is to assess if a request for a DMF prior review meets the criteria for a prior review as provided in the GDUFA 3 commitment letter. Today's learning objectives will be to identify when the holder of a DMF can submit a request for assessment 6 months prior to the submission date for an original ANDA amendment responding to a complete response letter, or an ANDA amendment seeking approval of a previously tentatively approved application. What we would like you to understand and learn is how to identify the criteria the ANDA submission must meet to fit under one of the 5 categories as outlined in the GDUFA 3 commitment letter, and also to understand when the criteria for each category is met. In this portion of the presentation, I will not be covering what criteria applies to the types of submissions as listed in the slide, as in above, but only the criteria themselves that must be met for a DMF prior review. In other words, I will not be discussing which DMF prior review category applies to an original ANDA, an ANDA amendment, or amendment seeking final approval. As a basic overview, there are 5 categories for criteria an ANDA submission must meet in order to be eligible for a DMF prior review. Some may note that the criteria for a DMF prior review are similar to the priority review factors for an ANDA as found in the prioritization map 5240.3, currently in revision 6, except for the first bullet. However, please be advised that the criteria for a prior review of a DMF is based on the GDUFA 3 commitment letter, and the priority review determination of an ANDA under the map are separate entities and are applied differently. They should not be cross-referenced between DMFs and ANDAs. The first category that applies to a DMF prior review is that all patents and exclusivities will expire within 12 months of the planned submission date of the ANDA. And all these patents and exclusivities must expire within 12 months of the planned submission date of the original ANDA, the ANDA amendment containing response to a complete response letter, or an ANDA amendment seeking final approval of tentatively approved ANDA. Please note the other four categories of ANDA submissions that can qualify a DMF review prior to ANDA submissions are similar to prioritization factors reflected in the Manual of Policies and Procedures, which is also known as the MAP 5240.3, currently in revision 6. But this category does not have a parallel prioritization factor in the MAP. Please also note that the expiration of the patents and/or exclusivity relates to the submission of the original ANDA amendment or request for final approval, not to when the DMF prior review is requested. This requires some planning ahead between the DMF holder and the ANDA holder. Also, please note that the original ANDA itself may or may not be eligible for a priority review under the MAP. Second category for a DMF prior review is that with not more than 3 approved applications. Submissions for the drug products for which there are not more than 3 approved drug products listed in the Orange Book and for which there are no blocking patents or exclusivities listed for the reference listed drug or the RLD, and the ANDA applicant is not seeking approval for less than all the conditions of use in the RLD labeling. In other words, if there are fewer than 4 approved therapeutically equivalent drug products, including the RLD, listed in the Orange Book, and if there are no blocking patents or unexpired exclusivities for the RLD in the Orange Book, and the applicant is not seeking to carve out any conditions of use associated with an exclusivity or a patent, the DMF may qualify under this category for a prior review. Approved drug applications include both the NDA and ANDAs. Approved ANDAs listed in the inactive section of the Orange Book are considered approved drug products unless the ANDA has been withdrawn with a notice in the Federal Register. 505(b)(2) NDAs listed in the active section of the Orange Book and designated therapeutically equivalent to the RLD are also counted for purposes of determining whether there are fewer than 4 approved therapeutically equivalent drug products. Now, when we speak about the not seeking to carve out any condition or use, we're talking about information related to patent use codes or patent exclusivities. And that information has been removed from the ANDA proposed labeling. Again, this would be information that the ANDA holder would need to communicate to the DMF holder and determine if the DMF would be eligible for a prior review assessment. This category tends to create some confusion with industry. Often the mistake is made when requesting a review under this category is to only look at the active section of the Orange Book for approved applications and not factoring in the RLD as an approved application. The DMF holder and the ANDA holder, again, need to coordinate to make sure the DMF meets the prior review criteria. In the next slide, I will provide an example of how to find the RLD patent and exclusivity listings and considerations when determining if there are not more than 4 approved applications listed for a drug product. This slide is intended for attendees who may not be familiar with determining if the RLD still has any existing patents and/or exclusivities. First, locate the drug product using the Orange Book search section by typing in either the drug name or the proprietary name. Once the RLD is located, click on the NDA number highlighted in the yellow as in the first bullet. I'm providing you with a circling laser pointer to indicate what I'm discussing. Once you've clicked on the RLD number, a new screen will open with the information shown in the second bullet. Click the patent and exclusivity information highlighted in yellow here, and this will open a new screen as shown on the next slide. As one can see for this RLD, there are still unexpired patents and unexpired exclusivities. A note of caution: when the RLD has multiple strengths, you are advised to look at the patent and exclusivity listings for each strength, as they may differ in some cases where a patent or exclusivity is listed for only one of the strengths. This slide is meant to illustrate the confusion that sometimes occurs with determining if there are less than 4 approved applications. As can be seen on the left is a screenshot of the active section of the Orange Book for a drug product. One may then believe their DMF would be eligible for a prior review, assuming the RLD also has no unexpired patents and exclusivities. But one also needs to consider the applications listed in the inactive section of the Orange Book, as seen on the right side of the slide. Some of these ANDAs still may be considered approved because there has been no withdrawal with a Federal Register notice, as mentioned previously, and these would be considered still as an approved application when determining if there are not more than 4 approved applications. One should not assume that because ANDAs are in the inactive or discontinued section of the Orange Book that they cannot factor into determining if there are not more than 4 approved applications for a drug product. Next is the submissions related to drug shortages. This is rather an obvious category in that submissions that could help mitigate or resolve a drug shortage and prevent future shortages, including submissions related to products that are listed on FDA's shortage list at the time of submission. Please note that the FDA drug shortage list contains products that are currently in shortage and products that have recently been upgraded or updated to indicate the shortage has been resolved. If requesting a DMF prior review under the drug shortage category, please check the list to ensure the drug product is currently in shortage. Generally, the drug product should be listed on the FDA's drug shortage list to receive prior review assessment in this category, but drug products listed on other websites, such as ASHP, may be considered on a case-by-case basis. Submissions related to public health emergencies that either could help address a public health emergency or PHE declared by the Secretary of the U.S. Department of Health and Human Services under Section 319 of the Public Health Service Act, 42 U.S.C. 247D, or anticipated under same criteria as applied to such declaration. Recent PHEs, for example, have been COVID-19 and the opioid crisis. In determining which products could help address a public health emergency, FDA generally uses information from a variety of sources to determine which products are needed the most. Just remember that not every drug product that may be used to treat the complications or secondary illness resulting from a COVID-19 infection are eligible for enhanced review. And the same would apply to any declared or anticipated public health emergency. The FDA will make the determination which drug product or drug products should receive priority review based on a public health emergency. Submissions for sole source drug products. Submissions for drug products are products for which there is only one approved drug product listed in the active section of the Orange Book, and that product is approved under an ANDA. This means that the RLD is in the discontinued or inactive section of the Orange Book, and there is not more than one ANDA in the active section of the Orange Book. And two, the approved ANDA for the drug product listed in the active section was not approved pursuant to a suitability petition. Three, there are no blocking patents or exclusivities for the RLD. And four, the submission does not qualify for prioritization under any other factor listed in the map or the prioritization map. Although submissions for which the sole source product is a petition ANDA would not qualify a DMF for prior review, under this category, such submissions could potentially meet the criteria for the not more than 3 approved applications category. In the sole source category, the drug product would need to meet all 3 of those requirements, as well as not be eligible for a prioritization under the MAP. A RLD listed in the active section of the Orange Book, which has no unexpired patents or exclusivities and no approved ANDA, is not considered a sole source product. An ANDA approved via suitability petition is generally going to be in a different dosage form or different strength from the RLD. Once again, coordination between the DMF holder and the ANDA holder is very important when seeking a DMF prior review. In the following slide, I will provide a visual demonstration of ANDAs approved via the suitability petition. In the first bullet, one can see a screenshot of the Orange Book of a RLD that is listed in the discontinued or inactive section of the Orange Book. Please also note the strength of the RLD as 500 milligrams. The second bullet is a screenshot of the Orange Book listings for approved ANDAs for the same drug product. As one can see, the ANDAs are approved for a 375 milligram strength, which is obviously different than the RLD. These ANDAs were approved via suitability petition, and one can use the difference in the approved RLD strength and the approved ANDA strength to help determine if suitability petition may have been part of the original ANDA's basis of submission. In this case, had there been only one approved ANDA for the 375 milligram strength listed in the Orange Book, a DMF would not be eligible for a prior review. These are some resources that may be helpful to review when considering a DMF prior review. Remember, the MAP only applies to ANDA submissions and not a DMF submission. It is listed here as reference and not as a source to determine if a DMF would be eligible for a prior review assessment. Next, we have a couple of challenge questions for you to consider. Challenge question 1. If the RLD is listed in the inactive section of the Orange Book and there is one approved petitioned ANDA for the drug product in the active section of the Orange Book, a DMF could qualify for review prior to the planned submission of an ANDA under the sole source category. I'll give you a few seconds to think about that. The answer is false. The approved ANDA listed in the Orange Book has been previously approved based on an approved suitability petition. Therefore, the sole source prior review would not apply. The DMF prior review may be eligible under the not more than 3 approved applications category. Challenge question number 2. If there are no approved generic applications in the Orange Book and there is an unexpired exclusivity listed for the RLD, but the ANDA applicant is seeking to carve out or remove the condition of use covered by this exclusivity in the proposed ANDA labeling, a DMF could qualify for review prior to the planned submission of the ANDA under the not more than 3 approved drug products category. Again, I'll give you a few seconds to think about that. The answer is false again. The GDUFA 3 commitment letter does not allow for a DMF to receive an enhanced review if there are unexpired patents or exclusivities listed in the Orange Book for the NDA, even if the information related to the patent and or exclusivity is being carved out or removed from the proposed ANDA labeling. This concludes my portion of the workshop presentation. Thank you for your time and attention.
Hello again, everyone. In order to help you understand the draft guidance and the prior assessment process, and also to highlight some important points, I will present answers to some pre-prepared questions. Question number 1. The draft guidance states the GDUFA DMF fee needs to be paid for FDA to grant a prior assessment request. Does the DMF also need to be available for reference? The answer is no. The DMF does not need to be available for reference for us to grant a DMF prior assessment. If there is a pending completeness assessment at the time the prior assessment is granted, we will process the CA as an administrative CA. It will get status complete and the DMF will go into the available for reference list. Please note that if the fee has not been paid, you will be issued a fix-it IR. So the payment issue can be addressed. If it is not resolved quickly in the response to the IR, then your request will be denied. Question number 2. We plan to submit the drug substance information directly in our application rather than reference a DMF. How can we get a prior assessment? So when the drug substance information is submitted within an ANDA application, that means there is no referenced DMF, then the prior assessment is not available. So to be eligible for the prior assessment, the applicant needs to change the submission strategy and file the drug substance information in a drug master file. Question number 3. The draft guidance states that request for prior assessment should be submitted to the DMF 6 months ahead of the planned submission date for the application. Can we submit the request more than 6 months prior to the planned submission date for the application? What happens if we submit with less than 6 months? Yes, you can submit the request more than 6 months before the planned application submission. We will make the grant deny determination at the time the prior assessment request is received. However, the assigned DMF review target date, the DTD, will be based on the planned application date, and you won't get an earlier date because you submitted the prior assessment request way in advance. To continue, The 6-month condition is in place so that FDA has adequate time to plan and conduct a full DMF assessment, while also being able to meet the DMF timelines for applications that have a GDUFA goal date. So if you submit the prior assessment request with less than 6 months to the plan submission date, your request will be denied unless you are qualified for a waiver, which we will discuss in the next question. Question number 4. The draft guidance states that for drug shortage or products that could help address a public health emergency, the condition that the prior requests be submitted to the DMF at least 6 months prior to application submission can be waived. How can I make such a waiver request? And how will the DTD be set if the waiver is granted? The plan submission date of the ANDA amendment or the prior approval supplement should be at least 6 months from the date the prior assessment request is submitted to the DMF. However, for drug shortage or products that could help address a public health emergency, a request to waive this condition may be included in the cover letter when you are unable to submit your request 6 months in advance. Please make sure to clearly indicate the qualifying factor in your cover letter. When we grant the waiver, and if you have provided at least 3 months before the plan application submission date, we would typically set the DTD to the plan submission date indicated in your request. But if you submitted the prior assessment request with less than 3 months lead time before the plan application submission date, the DTD will be set based on the available resources, which may extend beyond the plan submission date. Even when a DTD is set after the plan submission date, in cases when less than 3 months notice is given, the DMF assessment will still be finished significantly earlier than when no prior assessment was performed. Question number 5. Once a DMF prior assessment is granted and the DTD is communicated to the holder, can that date ever change? Yes. There are a couple of situations that could cause a DTD change. First case, submission of unsolicited amendments. If we receive an unsolicited amendment after granting the prior assessment, that can cause an extension to the DTD. How long it will be extended depends on the timing of the submission and the content of the unsolicited amendment. The second case is a marketing application opening a review cycle. So after we grant the prior assessment and we communicated the DTD to you, if an application cycle opens up that has an earlier DTD than the previously communicated DTD, then the DTD will be adjusted to meet the goal date of that application. Please note that we would only adjust the DTD in this case when it is resulted in an earlier date. Question number 6. My DMF references 2 secondary DMFs for intermediates. Will both be assessed if a prior assessment request is granted, or will these DMFs require their own request for prior assessments? As stated in the draft guidance, any secondary DMFs referenced by a primary DMF that is granted prior assessment will be assessed during the DMF prior assessment period. This means all secondary DMFs which are properly referenced by the primary DMF will be reviewed concurrently when the primary DMF is granted a prior assessment. You do not need to submit a separate request if your primary DMF references any secondary DMFs. Also, you should note that any consults associated with a primary or secondary DMF will also be covered during the prior assessment. Question number 7. What if the applicant cannot submit the ANDA application by the date indicated in the prior assessment request? The FDA's expectation is that the applicant will meet the plan application submission date committed to in the prior assessment request. And we again emphasize the need for close communication and collaboration between the DMF holder and the applicant when these requests are prepared and submitted. If circumstances arise that will delay or prevent the application submission, please notify us immediately at the DMF OGD mailbox shown here so that the FDA resources are not misallocated. If the application submission will come in earlier than the indicated planned submission date, you do not need to notify us. Please note that in this circumstance, the assigned DTD will remain in place. This slide contains some helpful links. This is the end of the presentations for this morning. I would like to take this opportunity to thank my Division Director, Dr. David Scanchi, for his help and guidance during the preparation of my presentations. Thank you very much, Dave. And I also would like to thank my colleagues, Erin Skoda and Jennifer Nguyen, for their input. And finally, thank you all for your time and attention. We will now go to the Q&A session.
Thank you all for the great presentations. We'll now enter into our second Q&A panel session of the morning. As a reminder, if you haven't had a chance to submit your questions into the Q&A chat pod, please do so now. We'll answer as many questions as time allows. Welcome to the Q&A panel of Dr. Ziyang Su, who's a policy lead in the Office of Pharmaceutical Quality and CDER. In this role, she leads work group meetings to develop new guidance and revise existing guidance. Her responsibilities also include reviewing policy proposals, providing consults to petitions, and responding to external inquiries. Looks like we have some questions coming in right now, and the first group of questions appears to be addressed to Dr. Erin Skoda. And here is the first question for Dr. Skoda. Is there any condition when a scientifically assessed DMF can be qualified for prior assessment in the context of an ANDA for a new dosage form? What if it has been more than 2 years since the last scientific review, for example?
Thank you for that question. The purpose of this enhancement for prior assessment is to maximize the efficiency of the DMF scientific review timeline. Therefore, DMFs which have not been previously scientifically assessed for an application are the focus of this enhancement, excuse me, since the first cycle review is the part of the process that tends to take the longest time for both the review and the response. This applies regardless of when the DMF was scientifically reviewed. The dosage form of the ANDA does not affect the consideration as to whether the DMF has been scientifically reviewed or not. In other words, if the DMF has been previously reviewed for an ANDA or an NDA, then the prior assessment process would not apply.
Thank you for responding to that question. We do have a couple more questions for Dr. Skoda, and here is the next question. Is prior assessment possible for a DMF that is referenced by a 505(b)(2) application? And are there other types of DMFs, such as type 3 DMFs, eligible for prior assessment?
Thank you for that question. The prior assessment process is applicable only to ANDAs. So 505B2 applications would not apply here. Other types of DMFs, such as type 3 DMFs, also are not eligible for prior assessment. The prior assessment process that has been established under GDUFA 3 applies to type 2 drug master files for APIs. Thanks.
Thank you for responding to that question. We have one more question for Dr. Skoda, and here is the question. How long does it take for FDA to grant or deny the prior assessment request?
So in this new process, our goal is to triage the request within 10 to 14 days of receipt. So again, this is receipt of the email to the DMF OGD mailbox. I know you've heard this multiple times today, but please remember that step when you're submitting your request for prior assessment. So after we receive the email to the DMF OGD mailbox, we strive to triage within 10 to 14 days, and then you will receive a letter granting or denying the request by about 14 days after that triage process. I just also want to remind you that that email also serves as a point of communication. So if we have questions or need to communicate with you, that would be how it's done. Thank you.
Thank you for responding to that group of questions. Moving on to our next panelist, we have a few questions that came in for Dr. Ian Margand. And here is the first question for Commander Margand. What if the new patent exclusivity is added to the RLD between the prior assessment grant and the ANDA submission? How does this impact the prior assessment process?
Thank you for that question. If a patent is listed after the DMF prior assessment is made and just before the ANDA is submitted, that wouldn't affect the DMF prior assessment review because that is assessed at the time and what the current patent listings are at that time. The ANDA itself, though, if there are patents that go past the 12-month goal date, then it would apply to whatever the MAP settings are. Thank you for that.
Thank you for responding to that question. We're getting a little bit of static from you, Commander Margand. If you can pull your microphone away from your mouth just a little bit, we'll try it again. And here's the next question for Commander Margand. How shall I understand when a DP has a patent but not exclusivity? What is allowed and what is not allowed when there is a patent plus exclusivity and when there is only a patent but not exclusivity?
Thank you for that question. Again, this applies to the DMF at the time of the review. If there are patents and or exclusivities listed, those patents and or exclusivities must expire within 12 months of the original ANDA submission. One can tell if there's either patents or exclusivities listed for an RLD by simply looking in the Orange Book listings for the RLD. Both the patents and exclusivities will be listed there. There is the slide that we have provided that gives that example. Thank you for that question.
Thank you, Commander Margand, for responding to that question. We're going to move on to our next panelist while our tech team reaches out to you to help you with a little bit of a microphone adjustment. Our next group of questions are for Commander Skanke. And here is the next question for Commander Skanke. Notification of prior assessment request to FDA, should this be sent by the U.S. agent or by the DMF holder?
That's a very good question. The submission can be sent by either the agent or the holder, but the cover letter in the request must be signed by the holder. The reason for that is you're granting permission for us to review the DMF, just like you do when you write a letter of authorization. And so like the letter of authorization, it has to have the holder's signature on the cover letter. Thank you.
Thank you for responding to that question. Moving on to the next question for Commander Skanke is the following. Can a DMF holder submit a new DMF and a prior assessment request together?
That's also a very good question. We want the prior assessment requests to come in as standalone amendments to the drug master file. So we don't want you to include them in other submissions, such as an original. You could submit them at the same time or very close to the same time, but we want the prior assessment request in a standalone amendment.
Thank you for responding to that question. We have a couple more questions that just came in for Commander Skanke, and here is the next question. What if the ANDA applicant submits the ANDA before the 6-month time mentioned in the prior assessment request?
Very good question. So if we've granted a prior assessment request, then we set our target date for completion of that review to the date that you included in your request. And if the application came in earlier than that, we would not go back and readjust the target date. So what would happen in that case is our review would actually finish, let's say you submitted it 2 months early, our review would actually be finished 2 months into the application clock rather than at the date of submission. So it would affect it in that way, but you're still getting a substantial benefit because the DMF will be completed very early in the application clock. Thank you.
Thank you for responding to that question. We have one more question for Commander Skanke in this round, and here is the question regarding Form 3938 is optional only a form for a proper prior assessment request, or is this for all types of FDA submission?
Very good question. At the present time, Form 3938 is not required for any type of DMF submission. A question we often get is when will it become a required element for DMF submissions? Unfortunately, I don't know the answer to exactly when, but until that time, we surely do encourage its use. It's being used successfully across the industry, and we are receiving lots of submissions with the Form 3938, but it is not a requirement for any DMF submission at this time. Thank you.
Thank you for responding to that group of questions. Moving on to our next panelist. Got a few questions that came in for Dr. Ziyang Su, and here is the first question for Dr. Su. Will there ever be an opportunity for a pre-review of DMF that will be referenced by an NDA when the submission is for a drug product that could help address a public health emergency or address an unmet medical need?
That's an excellent question. So at this time, there's no such mechanism for the DMF that will be referenced by an NDA to qualify the prior assessment, since the new drug application NDA is out of the scope of the GDUFA program enhancement. The current GDUFA enhancement applies to the generic drug applications only. Thank you.
Thank you for responding to that question. We've got a few more questions that came in for Dr. Su. And here is the next question. Who should submit the prior assessment request? DMF holder or an ANDA applicant?
Thank you. That's also an excellent question. So the DMF holder should submit the prior assessment request. However, as you have seen in the presentations, the communication between the DMF holder and the applicant is critical to ensure all the required information are included in the cover letter and to ensure all the conditions are met for the qualification. Thank you.
Thank you for responding to that question. We got a couple more questions that came in for Dr. Su, and here is the next question. Can FDA grant a prior assessment for the review of a drug substance information submitted in an ANDA?
That's a very good question. The answer is no. The prior assessment is only applicable to the drug substance information included in the Drug Master File (DMF) if the drug substance information is submitted as part of the original ANDA or amendment, that won't be qualified to apply for the prior assessment. Thank you.
Thank you for responding to that question. One more question just came in for Dr. Su, and here is the question. If a drug product contains multiple APIs, can multiple prior assessment requests be submitted for different APIs?
That's a great question. The answer is yes. So if the drug product contains multiple APIs, 2 or 3, very commonly seen in fixed dose combination products, then one prior assessment request can be submitted for each different API. Thank you.
Thank you for responding to that group of questions. Moving up to the beginning of our panel, we have a few more questions that came in for Dr. Erin Skoda. And here's the first question for Dr. Skoda. How do you know if a DMF has been assessed for a prior ANDA?
That's a good question. So for the DMFs that are submitting a prior assessment request, those requests, as were mentioned just recently, have to come in from the DMF holder. Usually, if a DMF has been reviewed for a prior ANDA, the holder will have received some sort of CR letter or IR letter if there was a scientific review that occurred. Or if the DMF is already adequate, it will have received a first adequate letter. In the case that you're still not clear on whether the DMF has been previously scientifically assessed, you could always submit a question to the DMF OGD mailbox to clarify and confirm that it has not had a prior assessment. Thank you.
Thank you for responding to that question, Dr. Skoda. We've got a few more questions that just came in for you, and here's the next question. Can we request for prior assessment of a DMF which is already scientifically assessed for another ANDA or NDA?
Thank you for that question. So no, once the DMF has been scientifically assessed for another application, and that specifically applies to ANDAs or NDAs, the prior assessment, the DMF is considered scientifically assessed, and so therefore the prior assessment request would not apply.
Thank you for responding to that question. We've got a couple more questions for Dr. Skoda, and here is the next question. What about completeness assessments that would have occurred in the 6 months prior to the ANDA receipt? In the timeline shown for GDUFA 3 prior assessments, CA is not listed.
Thank you for that question. So that's a good point. You'll note from the GDUFA 2 standard review timeline that in that timeline, in the 6 months prior to the ANDA submission, that's usually when we show the completeness assessment in the review timeline. In reality, that completeness assessment is triggered by the receipt of both the fee payment and the receipt of the DMF. Under GDUFA 3, we will continue to perform completeness assessments upon that trigger, so upon receipt of both the DMF and the fee payment. However, if a completeness assessment has not yet been started by the time we assign a DMF for a prior assessment review, the DMF will get an administrative completeness assessment and will be listed on the DMF available for reference list. Now, because an administrative CA is not a full CA, we continue to recommend that you can keep consulting the completeness assessment guidance to make sure that all necessary parts of the DMF are included in your submission.
Thank you for responding to that question. We have just one more question for Dr. Skoda, and here's the question. What if my DMF prior assessment request or 6-month waiver is denied? Will this impact the ANDA approval and submission process?
Thank you for that question. If the request for the DMF prior assessment or the 6-month waiver is denied, but the circumstances for the DMF or the referencing ANDA change, you can submit a new prior assessment request. So for example, if a new ANDA is referencing your DMF and the new ANDA meets the conditions described in the guidance for industry, you can then submit a new request that outlines the new conditions for that request. If either the prior assessment request or the waiver is denied, that denial will not affect the ANDA submission or receipt process. And in those cases, the appropriate ANDA review timeline will still apply to the application.
Thank you for responding to that group of questions. Moving on to our next panelist, we've got a few more questions that came in from Commander Ian Margand. And here's the first question for Commander Margand. Is it required to always list a drug shortage, or if an emergency will be applied for the submission in order to get a faster approval, can we apply this submission under normal conditions?
Thank you for that question. For a drug shortage priority review, the drug product must be in shortage per the FDA drug shortage list, which can be found on the FDA website. In certain circumstances, an applicant may request priority review or prior assessment review based on other information related to possibility of a drug shortage, but those products will be reviewed on a case-by-case basis and doesn't guarantee that a drug shortage DMF prior assessment will be granted. Thank you.
Thank you for responding to that question. We have a few more questions that came in from Commander Margand. And here's the next question. If there are no approved generic applications in the Orange Book, but there is one unexpired exclusivity which expires within 12 months of ANDA submission, will the DMF be eligible for prior assessment?
Thank you for that. Yes, if there is one patent or exclusivity listed for the RLD in the Orange Book, and that exclusivity or patent would expire within 12 months of the original ANDA submission, then the DMF may be eligible for a prior assessment. Thank you.
Thank you for responding to that question. We have a very similar question. We'll go ahead and ask this for Commander Margan. If the RLD is discontinued but patent is there, can we still apply?
That's a very good question. It depends on the expiration date of the patent. An ANDA holder is expected to address all unexpired ANDA or NDA patents at the time of their submission. So if the unexpired patent that's listed for the RLD, even though the RLD is discontinued, that would factor into whether or not a DMF is eligible for a prior assessment, and also if that would expire within 12 months of the original ANDA submission. Thank you for that question.
Thank you for responding to that group of questions. Moving on to our next panelist, we've got a few more questions for Commander David Skanke, and here is the first question for Dr. Skanke, and here's the scenario. If a drug product is a combination of greater than one APIs and is in drug shortage, out of them, for 2 DMFs, FDA has completed substantive review of the DMF. However, DMF holders did major changes in ROS and amendments submitted to the FDA. So, in that case, whether only one DMF for which the substance review is not done will be eligible for a prior assessment request, or all 3 DMFs.
Yeah, this is a very interesting scenario. So here we have 3 DMFs for the 3 different APIs. Only one of them is a DMF that has not undergone a substantive scientific review before. So, and because this is a drug shortage, that would be one that would qualify for the prior assessment. The justification would be drug shortage, and it would be in scope because it hadn't received a review. The other 2 DMFs that had received a substantive scientific review, even though the major changes were done, those would not be eligible for prior assessment. What our recommendation would be to the applicant in this case would be to contact FDA and see if regulatory discretion was available to take a look at the changes to those DMFs prior to submission. But of course, regulatory discretion is done on a case-by-case basis, and it would depend exactly on the nature of the shortage. So short answer, only one DMF would qualify. The other DMFs you would want to discuss with the agency because it is for a drug shortage. Thanks.
Thank you for responding to that question. We have just a little over 2 minutes left. We're going to try to squeeze in one more question. And the final question, we're going to send it over to Commander Dave Skanke. And here is the question. If a DMF prior assessment is not granted, will the DMF fees be refunded, or can they be used when ANDA application triggers the DMF review?
That's also a very good question. So there really wouldn't be a need to have a fee refunded just because a prior assessment was not granted, right? Because the drug master file has to be available for reference, and paying the fee and passing your completeness assessment are required for that. And so even if you're not getting a prior assessment, when the application comes in, you still have to be available for reference. So the DMF fee still has to have been paid. So there really isn't a scenario where you would want to do that. because the application is still going to be submitted and we're still going to review the DMF. We're just not going to be picking it up early. So I can't really foresee a scenario where anybody would ever want to do that. Thank you.
Well, that's all the time we have for questions. A huge thank you to our panel for answering numerous questions that came in.